The face covering and code of use bylaws report lays out staff's recommendation to align our local bylaws with the provincial regulations in terms of when they would be lifted. Since the introduction of the bylaws, staff reports have laid out 3 criteria for recommending when the mandatory requirements would end. As outlined in the report, staff believe the 3 criteria have now been met. Lastly, the lifting of mandatory measures does not mean the pandemic is over. COVID-19 continues to be with us, and masks are an added layer of protection when the risk is higher, such as during the winter respiratory season, and if and when we have another wave. Thank you. Through you, Chair, I wasn't sure whether the question really should go to the Medical Officer of Health. And I may ask it at a different time. Good job, Shuli. But what this really means is we have the choice. And I'm choosing to wear my mask, number one, because I like it. and I think it does serve a purpose. And until it gets really warm, I'll probably keep it on. But thank you.
I'm on the side of removing the mandate. This to me is something that I agree with Councillor Foxton when she said this is about choice, and that's what this is. I'm not saying I will never wear a mask. What I'm saying is I want to decide where and when I wear a mask or I don't wear a mask. For example, when I go grocery shopping, I'm going to wear a mask because I'm going to be around people I don't know. However, I do participate in some community groups where I know those people. I know they're triple vaccinated as I am. I know enough about them to know what they do outside of our group. I'm 100% confident in the fact that they are on the same page as I am.
Thank you for allowing me the opportunity to speak to you today regarding your decision to repeal the face covering bylaw. I'm coming here as a single parent to an immunocompromised, disabled, medically complex, high-risk child, and also as a pediatric nurse. And I'm asking you to maintain the bylaw for face coverings in all essential settings for the time being, most notably until all age groups are eligible for vaccination. Masking is a reasonable protective measure to help blunt COVID transmission and should not be stopped at this time. My daughter has been ventilated in the kids' pediatric ICU with influenza and hospitalized multiple times. These experiences are incredibly stressful, and I would never wish that trauma on another family. We have spent the past 2 years isolating with extremely limited contacts, myself unable to work, no schooling, and only going out to access essential services. I cannot restrict our life any more than I already have for the past 2 years.
I am the mother of an immunocompromised 3-year-old named Morgan. Morgan's always been a fighter starting at birth. During her stay at the NICU, Morgan was both on a feeding tube and a CPAP machine. Between the hole in her lung and the amount of fluid inside of her lungs at birth, we've always been told to be extra careful when it comes to respiratory illnesses. This isn't a hypothetical in our home. This is a lived reality that we never want to experience again. Morgan first started using a steroid-based anti-inflammatory inhaler at 15 months. A simple cold can make it extremely difficult for Morgan to breathe. We have spent many a night upright, holding her just so that she can sleep without her airways blocked.
Is that the report states that our 7-day average case rate is roughly 8 per 100,000, and that it has been below 20 since February. However, the report does not mention the impact of limited PCR testing on the case rate. The Chief Medical Officer of Health has stated that the actual case rate is 10 times the reported rate, which means our actual case rate is more than 80 per 100,000 and hasn't come anywhere near 20 for the current wave. This is a very high rate of COVID infections, and we've been stuck at this level for the past 4 weeks. With such widespread infection, it is too early to remove the mask mandates.
I'm going to call the question. Please use your icons to vote yes or no. That is carried unanimously. Thank you, colleagues, for that. And again, a good discussion in all points that I think will come up in the community. And this is a bylaw to repeal bylaw 035, a bylaw to require the wearing of face coverings in enclosed public spaces during the COVID-19 pandemic, and amending the bylaws 20-052 and 21-25, and a bylaw to repeal provisions of 13-050, a bylaw respecting the conduct of persons entering into buildings, grounds, and public transportation vehicles owned or occupied by the Regional Municipality of Waterloo. And that was long enough to read that you have all voted. Thank you very much, colleagues. That is carried. Before we adjourn, I want to recognize the lifting of the public health measures across the province, and the return of warmer weather brings new changes to our daily lives. As we go about these changes, it is important that we all err on the side of generosity, grace, and kindness when interacting with our fellow residents, family, and coworkers.